I'm Augie Galindo. I'm one of the owners of Testosterone Centers of Texas. We have been in business since 2012. We now have 5 clinics in the DFW area. Estrogen replacement therapy for women is something that has been done for quite a while. It's had its ups and downs, and the way it works has also changed throughout the years. This became really popular around 2000, and so it was thought that it was going to be the thing that changed women's health as they enter the premenopausal or perimenopausal, rather, menopausal years. The hot flashes and and osteoporosis, all the things that women have been dealing with for centuries, for millennia, was becoming more and more problematic, and they were realizing that they needed an answer for that. Estrogen replacement became that answer, but with the way that it was done early on, it was leading to increases in breast cancer, and then also with progesterone and the balance between it was also leading to other serious issues. So HRT, as it first hit the market, has changed quite a bit now. So the way that we approach it at Testosterone Centers of Texas is I will usually use a bioidentical hormone replacement approach for estrogen and progesterone. So I don't use a conjugated estrogen, I don't use a progestin. We want to use the molecule that's just like what your body would make on its own. So as a woman, either even in a premenopausal state, whether you're in 30s or 40s and just having problems with unbalanced hormones, or you're approaching that perimenopausal and menopausal state where estrogen levels start to drop as ovaries begin to fail to do their job, this is where we want to jump in and help, because the symptoms that you're going to be seeing would be things like, again, hot flashes, vasomotor instability is what leads to that, and then of course it can be, depending on what parts of your body are being most affected, you can have vaginal atrophy that could lead to more problems with urinary tract infections. So the way that this looks when we treat is we want to go in and replace that estrogen level to curtail those symptoms, but not cause another problem by making you estrogen dominant. So that has to be balanced out with other hormones. The causes of clinically low estrogen for females really has to do with ovarian activity, and so this is most commonly going to be seen when a woman is approaching menopause. This is when things start to become somewhat erratic with the communication between the pituitary gland and the ovaries. Follicular stimulating hormone and luteinizing hormone continue to be produced, but as they even ramp up to try to gain better control over the ovaries and their production, the ovaries may not respond appropriately. They may respond inappropriately now and then go back to normal response, and then it could be this back and forth for a period of months to even years. And that's why we call this the perimenopausal period. It's not a clear line in the sand when this starts, but this is something that usually by early 50s, a woman's going to be past this mark of perimenopause and actually menopausal at that point. So that's the main reason, but really ovarian dysfunction overall, that can happen really with anybody. It can also happen if you have to have a hysterectomy or an oophorectomy, where they actually have to take out the ovary because of a number of reasons. They could have a torsion, they could have an ectopic pregnancy. There's a lot of things, or just an abdominal injury of sorts that would destroy or hamper the normal production of an ovary, and that's usually where you're going to get estrogen deficiency in women. All women will experience a drop in estrogen because of menopause eventually. Again, the ages will differ there, but what menopause is basically the dormancy of the ovaries. So when they stop producing estrogen, you're not going to have a normal amount of estrogen in your body unless you replace it. The results you can expect after beginning estrogen therapy, again, will kind of vary on what you're feeling going into it. For the classic perimenopausal, the menopausal woman who's experiencing severe hot flashes and maybe even seeing a drop in bone density, those things should improve. That's really going to be kind of the focus of therapy, is to keep you from having to sweat through your sheets every night and have to leave the room and find cool air. So just management of those vasomotor symptoms is what we seek to establish first. Now, if you are experiencing low estrogen well before that, say in your 30s, and your symptom pattern may look completely different, but whatever symptoms are tied to those estrogen issues, if you have vaginal atrophy, where there is a change in the vaginal tissue, it's become thinner or drier, and you're having pain with intercourse, those are things that can be better with estrogen therapy if that's what you're experiencing. There are essentially 3 different types of estrogen, so estrone, estradiol, and estriol, and so depending on what's imbalance there, we may need to change the way that we approach replacement therapy, and then that will change the symptoms that you had from the low estrogen. I am Augie Galindo. I'm one of the owners of Testosterone Centers of Texas. Thank you for listening and watching, and if you would like to learn more, go to tctmed.com.